Hi, my name is Melissa Rower. For my integrated practice project, I chose to focus on compliance with hand hygiene, being that that is such a large part of our day as nurses. Um, for the first week, I went ahead and got approval from my nurse manager to approach the certain nurses on my unit about what I was doing and what kind of participation I would need from them. With that, I chose to interview fewer nurses in order to keep it a little more personal rather than choosing a larger group setting. I felt like if I were able to approach the nurses from a one-on-one standpoint, I would be able to have more of an open dialogue as to what they struggled with when performing hand hygiene, or why they may not be performing or why they may not be compliant with our hand hygiene requirements. Week 2, I started to gather sources from scholarly articles about the importance of hand hygiene and exactly how hand hygiene does affect our patient population. With that, there was a lot of information about preventing healthcare acquired infections, and that played a large role in the information that I used as well. For Module 3, I approached certain nurses in a one-on-one setting, like I said earlier. I approached them about what they were struggling with and how they felt their compliance was. The vast majority of the nurses that I approached, their biggest struggle was complying with hand hygiene when something critical was happening to their patient. A lot of the times it seemed that they would grab a pair of gloves instead of performing hand hygiene when they needed to respond to whatever was going on with their patient quicker. In Module 4, I checked back in with the nurses to see how they felt they were doing. The previous week I had given them some information in the brochure about how to increase hand hygiene and just trying to increase awareness of hand hygiene. As nurses, we see a lot of this information floating around our units at any given time of the year. We have to do online learning resources about hand hygiene compliance. We have to sign a paper about it. So we're definitely very aware of the importance of it, but I think implementing it and putting it into practice is something that we tend to struggle with. So I just checked in with them to see how they felt they were doing. During week 5, I began to take a look at the data that I had received from them, as well as all the information that I had found online. Just trying to kind of analyze what was effective and what wasn't effective within the project. I did feel like I had a more open and honest dialogue by approaching these nurses individually versus a group setting. So I did like that aspect of it, but I think that as healthcare professionals, we will continue to struggle with being 100% compliant with hand hygiene. But after talking to the few nurses that I had worked with, they were very much aware of the importance of hand hygiene. For the final week, I looked at all the information that I had received from them, as well as kind of just gone over what I had put into the project as well. Just kind of looking back and seeing whether or not I felt like the project was successful. And just kind of like I said earlier, I feel like there's always a constant reminder wherever you go within hospitals to perform hand hygiene in and out of your patient's room. And so I think the biggest struggle with that will be actually implementing it, and that will just have to continue to be reinforced.